Dementia is not a single disease. Instead, it is a broad term describing symptoms that affect memory, thinking, and social abilities severely enough to interfere with daily life. Think of it as an umbrella term. Underneath are specific conditions like Alzheimer's disease, which is the most common cause. These conditions are caused by physical changes in the brain. Neurons become damaged, lose connections, and eventually die. For an occupational therapy student, understanding dementia is fundamental for providing effective and compassionate care. Occupational therapists help people participate in meaningful activities through therapeutic use of everyday occupations. When dementia enters a person's life, it strips away their ability to perform these occupations. Dr. Barry Reisberg developed the Global Deterioration Scale in the early 1980s. It remains one of the most trusted tools for staging primary degenerative dementias like Alzheimer's disease. The scale focuses on observable behaviors and functional abilities. It maps the entire continuum from no cognitive impairment to the most severe late stages. Stage 1, normal. Stage 2, forgetful. Stage 3, confused. Stage 4, early dementia. Stage 5, assistance needed. Stage 6, severe assistance. Stage 7, dependent. For occupational therapists, this shows the strong correlation between cognitive decline and functional decline. It shows how memory loss affects the ability to get dressed, prepare meals, pay bills, and find their way home. This knowledge helps you anticipate needs, introduce strategies, and provide support at the most opportune moments. Remember, stages are not rigid, they're fluid guidelines. People may show symptoms from multiple stages, and progression varies widely. Factors like overall health, social support, and specific type of dementia all influence progression. Use the framework as a dynamic tool to observe, assess, and understand your client. It provides structure to build a responsive, person-centered care plan that evolves with your client's needs, ensuring your support is always relevant and impactful. Stage 1 is defined by complete absence of cognitive impairment. This is a normal, healthy adult with intact memory, judgment, and problem-solving skills. They function independently in all aspects of life, managing work responsibilities, personal finances, and social activities. For OT students, this stage represents the baseline. Understanding a person's normal habits, routines, and preferred activities becomes invaluable if cognitive health changes. Your role in Stage 1 is health promotion, educating on brain health, physical activity, and building cognitive reserve. Stage 2 shows very mild cognitive decline, often associated with normal aging. Individuals might occasionally forget familiar words or names of new acquaintances. They might misplace everyday objects like keys or glasses more frequently. However, these memory issues are very subtle and not apparent to family members or medical professionals. The key feature is internal awareness. They might say, "I feel like my memory isn't as sharp as it used to be." The emotional experience is often mild anxiety or concern about these subtle changes. Your role is supportive and educational. Introduce simple compensatory techniques like calendars, planners, and designated spots for important items. Stage 3 is when cognitive changes become noticeable to close family and friends. Increased difficulty with word finding and naming becomes apparent in conversation. They might read a passage and retain very little of what they just read. Decreased performance in demanding work or social settings becomes evident. They might struggle to organize complex projects or have trouble planning events. During assessment, you might observe difficulty following multi-step commands or getting lost in details. Evidence of poor planning appears, like buying duplicate grocery items because they forgot what they had at home. While basic self-care remains intact, complex instrumental activities begin to falter. The person is typically aware of their deficits, leading to anxiety, frustration, or denial. They may become adept at covering mistakes or withdraw from challenging situations to avoid embarrassment. Your role becomes crucial. Implement structured compensatory strategies like detailed schedules, pill organizers, and simplified systems. Introduce environmental modifications like labeling cabinets and drawers to make finding items easier. Begin caregiver education. Teach family members simple, direct communication and patience during word searching. Stage 4 typically marks formal diagnosis of early-stage dementia. Cognitive deficits are now clear. unable to recall what they had for breakfast or remember recent major news events. Struggles with complex mental tasks like counting backward from 100 by sevens. Reduced knowledge of personal history, forgetting their address or old telephone numbers. Clear functional impairments appear. Managing finances becomes difficult, often leading to risky mistakes. Safety becomes a primary concern requiring thorough assessment. Emotional experience includes confusion and withdrawal, blunted emotion and avoiding challenges. Denial is common. They might accuse family members of taking misplaced items rather than accept they lost them. OT focus shifts to safety and caregiver support. Remove trip hazards and install automatic safety devices. Maintain engagement through simplified hobbies, large print puzzles, and simple gardening tasks. In Stage 5, individuals can no longer survive without assistance. They are often disoriented to time and place, not knowing the date, day, or where they are. Unable to recall significant personal details like home address or high school name. However, they typically still know their own name and names of spouse and children. They require no assistance with basic self-care like toileting and eating, but they need help choosing appropriate clothing for the day or season. Your role is assessing what level of cueing is needed, verbal, visual, or physical. Emotional state often becomes less anxious. They live more in the moment and can still experience joy, sadness, and fear. Their world becomes centered on sensory experiences. A beloved grandchild brings joy while chaos causes agitation. OT intervention focuses on simplification and structured routine. Break tasks into one-step instructions. Lay out clothes in order. Serve one course at a time. Stage 6 shows severe cognitive decline with profound memory problems and limited environmental awareness. They require significant assistance with all activities of daily living and may experience incontinence. Personality and behavioral changes become pronounced. Delusions, hallucinations, agitation, and disrupted sleep cycles. Communication becomes limited to short phrases or single words, increasingly nonverbal. Therapeutic approach centers on comfort, safety, and quality of life through sensory-based interventions. Stage 7 represents very severe decline with minimal verbal ability and need for total care assistance. Understanding these stages transforms you from a technician applying interventions into a compassionate guide. This knowledge allows you to walk alongside clients and families through one of life's most challenging paths. In early stages, empower independence. In middle stages, adapt environment for safety. In late stages, provide comfort and preserve dignity. This framework equips you to educate families, helping them adjust expectations and become confident care partners. Ultimately, mastering these stages prepares you to see the person, not the disease. Even in advanced stages, when memory and language are gone, the person remains with capacity for joy, comfort, and connection. Your role is finding ways to unlock that capacity, creating moments of meaning and peace. By understanding this progressive journey, you honor the humanity of each individual you serve, making a profound difference until the very end of their life.